Welcome to Let's Talk Drugs, a series which will cover and take a deeper look into psychoactive substances. Today I would like to discuss chlorpheniramine, also known as CPM. Let's start with a brief history of chlorpheniramine. It is a first-generation antihistamine, that was the first class of antihistaminergic drugs synthesized, including drugs such as diphenhydramine and doxylamine, both of which are commonly used over-the-counter drugs. CPM was brought into medical use in 1949. Chemically, like many other first-generation antihistamines, it is classified as an ethanolamine. Before we learn about the uses of CPM, I think it would be worthwhile to look at the pharmacology of CPM. Looking at the receptor affinity of CPM, we can see it primarily acts as a potent antihistamine with secondary actions as a mild selective serotonin reuptake inhibitor, and has relatively weak anticholinergic effects. Looking at the medical use of CPM, it is approved in both US and EU for treatment of seasonal allergies and hay fever. The recommended dose is 4 mg every 4 to 6 hours in adults, and 2 mg every 4 to 6 hours in children. It is advised to not exceed a dosage of 24 mg of CPM in 24 hours. Typical side effects of CPM at medical doses can include sleepiness, dizziness, confusion, restlessness, anxiety, weakness, dry mouth, urinary retention. As with all first-generation antihistamines, CPM is not recommended for use in those over age 65 due to increased risk of developing dementia. Due to having off-target SSRI activity, CPM has seen off-label use as an antidepressant, usually by those looking for an over-the-counter option to treat one's depression. CPM is also found in Coricidin cough and cold in combination with 30 mg of dextromethorphan. Due to both drugs having serotonergic activity, overdose of CCC has resulted in serotonin syndrome, leading to cardiac events and even death among users. Pure CPM is less often abused, but some cases have been documented with anecdotal reports uploaded to forums like reddit.com and arrowwid.org. Before we observe the recreational effects of CPM, please note use of any drug is not encouraged. I only aim to inform and educate the public on these matters. On its own, CPM is rarely abused, acting as a deliriant in high doses, similar to drugs like diphenhydramine, scopolamine, and doxylamine. CPM is not often the first choice for deliriant users due to its relatively weak anticholinergic effects. Drugs like diphenhydramine are just as easily accessible and act as more potent and direct anticholinergics via antagonism of the muscarinic acetylcholine receptor. When used in a recreational manner, some of the effects may include sedation, muscle relaxation, tachycardia, anxiolysis, hypertension, arrhythmias, dreamlike states, deliriant visuals, delirium, memory loss, seizures. The dosage chart for recreational CPM use is as follows. Light, 6 to 10 mg. Common, 10 to 16 mg. Strong, 16 to 20 mg.